Hello, everyone. Welcome to our Avini Family Zoom. I'm Robin West in California, and I'm excited to welcome you here today. We have a special call today. We are excited to welcome our CEO, Neil Roth, and our CSO and biochemist, Rik Deitsch. It's going to be an awesome call. We're glad you're here with us. And if you're listening to the recording, welcome. If you're brand new, we want to thank you for coming and taking your time to check Avini out. And I know you're going to be excited when you hear the information. Make sure you get back to the person that invited you to the call and get your questions answered and how you can get involved with us. And we welcome you. My family has been touched dramatically by these products in many, many ways. We have family members who are on the spectrum of autism and have gotten their lives back and quality of life just miraculously with our Cell Defender. We have all natural products that are very unique, and it's about your body getting the help to heal itself. So without further ado, I would like to turn the call over to Neil Roth, our CEO.
Good afternoon, everybody. Thanks for taking the time. I think this is going to be a really good call for everybody. I got a few things to go over, then Rick's going to take over for the next hour. Okay, so I know that's what everybody's waiting for. So I will speak at New York speed quickly. A couple of things. Number one is don't forget this is the end of the month. You got to get, if you need your new distributors, if you need your retail customers, you got to get them in by Thursday night at midnight Pacific time. So get that done. It's been a great month. Let's keep it up. Number two, we have been going through and cleaning up auto ships. If you guys go back into your offices in the back office, you have a way of taking a look at who does and who doesn't have auto ships in your organization. I would suggest you look at it, because if you have leaders, we need to lead by example. They need to have auto ships in the system. Okay. So please take a look at it. We have been bringing in anywhere from 300 to 500 people a month, and we're not getting that in auto ships. We're going up, but not enough. Please make sure that when you bring somebody in, they understand the value and the need for auto ships. The value obviously is the 20% in rewards points, but the need is what we've been able to accomplish in terms of people getting to where they want to be each month is that by the 11th of the month, now that we moved it to the 11th, what your base is, if you can get as many people as possible on the auto ships. Okay. Oh, I got this leg, I got to do this too, and this leg, I got to go this too, because the comp plan is so simple. You know exactly what you need to do. But if people are on auto ships, you will get there better, faster, and more efficiently, and not have to wait until the last day of the month to try to figure out what to do. Not that it's in your best interest to get people on the auto ships. The last thing is something that I really want to talk about. Every time you hear from me, you're going to hear this, and that's prioritize prevention. Okay. If we're going to be a long-term successful company and helping people live their lives the way we want them to live their lives, to live a great life, we need to make people understand that prevention is the real deal here. Yes, if you're ill, there are things that increasing your immune system and cleaning up your immune system is going to help. There's no doubt about it. We proved it time and time again. But there's nothing better than preventing it from happening. Make sure you have that in your lexicon as you're moving forward, okay? And by the way, Rick is going to be talking now about the new pet products. Guess what? Dogs and cats need prevention also. Don't wait for them to be sick, okay? There's no reason as your dog or cat is getting older that you're not giving them some pain relief and stuff, because they really can't tell you if they're hurting, but they may be, okay? Rick, without that further ado, it's all yours.
Thank you for having me, as always. Let me do this view. All right, so I want to say a couple of things, and I talked about this the other day, exactly what Neil just said. I don't mind answering questions about disease states or drug interactions. I'm a biochemist. I'm both a pharmaceutical and a nutritional biochemist. So I don't mind answering those questions, doing product evaluations, certainly talking about what your physician has told you, what drug interactions might be. But we really need to not just focus on sick people. I tell you, there's some people I am convinced just wait in front of hospitals with our products as people are coming out the door, or worse, coming in the door and telling them we have the solution. Yes, our stuff is fabulous. It can help everybody. When I talk about who has toxic exposure, and you see my book, Invisible Killers, we all have toxic exposure. Every man, every woman, every child, every dog, every cat, everybody has, every plant has toxic exposure. So everybody can benefit from our products. So don't just target all the sick people. Make sure you talk to everybody. And I borrowed a line from Dr. Stuart Lonke. He talks about the worried well, people who are healthy and want to stay healthy, and they're worried about that. And so that's where certainly our products come in. That's the first thing. The second thing is, and I tell this at every conference, every lecture, I talk about analysis paralysis. So there are people that come in and they understand the power of the products, but they feel like they can't share this with anyone until they know everything. And I warn people against that, not because we don't have the information. We have the information. I will bury you in data. I'll give you every kind of clinical study. I'll give you all the presentations, all the content that's been created over the last 20 years. I will make sure you guys have everything. A lot of that's already available online, but it shouldn't stop you from sharing this with people. You don't need to know everything I know to be able to share these products with people. All right. So I warn people against analysis paralysis. Use the product, start sharing the products. You will get educated over time. And the best thing you can know is that we know it. So if you have a question, we can answer that question. We've already given a lot of this information out there already. There's a lot of stuff on Avini training, on Avini Health training. So we have that information, but don't stop doing what you're doing because you think you need more education about it. We have that information to share. So with that, I actually wanted to start talking about the pet products. We did launch these all the way back in March, but we had a series of events that occurred with manufacturing, especially now moving into our new facility, that delayed the launch of the pet products. I want to go back to the beginning and talk about those products. So we start with the Avini Health philosophy, which is unique products, of course, made with the highest quality ingredients and proprietary manufacturing processes that we've talked about ad infinitum, and they're exclusive to the Avini Health family. You can't get these products anywhere else. It's products that everyone needs. When they hear about it, everybody wants it, and these are the only place to get them. But then we talk about for humans. It's not just for humans anymore. We have Avini Health for our companion animals, specifically for dogs and cats. And the little bones are for dogs and the little fish are for cats. Now we know this is a huge market potential. There's over 85 million cats. There's over 78 million dogs just in the United States. Back in 2021, Americans spent $124 billion, billion with a B, on their pets. That was about a 17% year over year increase, over 30% increase since 2018. So people are spending more and more and more on their pets. And we see it. How many times you go to the store now? And I go to Publix to go shopping and people have their dogs in Publix. That never happened before. They're becoming more and more ubiquitous. People are carrying their cats around, their dogs around. And it's true because people will spend more on their pets than they do on themselves. That is an absolute fact. I know I have 2 dogs. I'm a dog lover. And if anything was wrong with my dogs, I would do anything for them. But what about dogs' toxic exposure and cats' toxic exposure? So just like us, they're exposed to toxins on a daily basis, sometimes even more, especially dogs living outside. There's exhaust fumes, there's herbicides and pesticides that are blowing in the air. And then I've talked about this before. One of the number one cause of arsenic toxicity for our pets is weather-treated wood. And I say this all the time. If you go to Home Depot and you go to the wood section, you'll see on the wood that's used for outdoors for building decks and picnic tables and fences, there's a red sign on the wood that says, warning, contains arsenic, because they actually treat that wood with arsenic chloride to prevent termite damage. And in fact, one 12-foot 2x6, which is like one plank that would be used in a deck, is enough arsenic in it to kill 200 adults. So there's a lot of arsenic in that wood. And it warns you, don't burn the wood, don't touch it and eat, wear protective goggles and gloves when you're working with the wood. And yet after we build our decks and we build our picnic tables, we took that sticker off and we don't warn anybody. And the fact is, if you have a wooden picnic table, don't touch it and eat. Wash your hands, put a tablecloth over it. And it's really bad for our companion animals. Dogs and cats, especially if they have a chew toy, they'll chew it, it'll roll around on the wood, it's picking up arsenic, and they chew it some more. It becomes the number one source of arsenic exposure for our companion animals. So that's something you should understand, it's something we can deal with. Even indoors, you have cleaners and detergents, synthetic fibers and carpet, perfumes and lotions that we use that they can pull in volatile organics from, flea collars and pesticides that we actually use for our pets, pollutants that we track in on our shoes can be full of heavy metals and even their pet food. We know that rice contains arsenic, and there's a lot of rice that's used in pet foods. And if you remember, just a few years ago, China actually put melamine in foods. Melamine is almost like a plastic that's used in building materials. It's very high in nitrogen. And the way we monitor the amount of protein in animal foods is we measure the nitrogen. Okay. They would add melamine to the pet food because it looked like it was extra protein. And they could say, look how much protein is in it. And it actually killed a lot of dogs and cats, was pulled off the market. I think someone in China was even executed over it eventually. But we got to watch out for that stuff. And then when you're taking your pets for a walk, they're walking on lawns that have herbicides and pesticides in it and fertilizer on it, and they're walking on it and they're licking their paws and they're coming into your house with that. So there's a lot of toxic exposure for our animals. And so they can get the same benefit from Cell Defender that we get. And now we have the Cell Defender for dogs, the Cell Defender for cats. We recommend up to 2 chewables a day. There's actually 60 capsules in each, so it should be a month's supply. But the one chewable is the equivalent of 10 drops. Okay, so they're getting what would be a full adult dose per chewable, which is certainly going to be effective. Again, just with us, they should be drinking water. So make sure that there's water available for your dogs and your cats when they use it. And I'm going to reiterate too, people that have already tried the product, or of course your animals that have tried the product, we're getting better and better and better at both the flavor, the smell, and the consistency of the product. We made some just today, and it came out nice and spongy, like a nice chewable. We actually bought a new oven just to make this product that we just set up in the new facility. And in fact, these products are now the first products made in our new facility in Boca Raton, our 18,000 square foot facility. So we're finally now manufacturing that facility, and these are the first products coming out of it. So these are the Cell Defender for dogs and cats. They are available. The dog product is chicken flavored. It's actually what they call charred chicken. It is a hypoallergenic chicken flavor. This is important because a lot of dogs are allergic to chicken. In fact, someone said just last week they couldn't use it because their dog's allergic to chicken. It is hypoallergenic chicken flavor. So even if your dog is allergic to chicken, they can use this product. And it's charred chicken. So it's really like a barbecue chicken flavor, like a smoky chicken flavor. It's actually pretty good. So if you want to try it yourself, it's pretty good. And then for cats, we use a tuna oil extract. So it's a very strong tuna flavor for cats. And it is very strong when we cook with it. The whole place smells like tuna. It is piercing flavor and piercing scent. But cats do like it. We have tested in cats. The first products that came out were a little hard for some cats. But I got to tell you, it's also about finickiness. Most dogs will eat anything. I have a friend who his dog is his whole life, and he will cook a steak for his dog and then make himself a bowl of cereal. That's just the way he is. He treats his dog better than he treats himself. And his dog was a little finicky with our treats, wouldn't try it. But once he tried it, he loved it. We had to get him to actually eat it. But same thing with cats. We have Carla in the office. Her cat wouldn't eat it at first. But when she feeds the stray cats outside, all of them ran right up and took it from her. So I said, you just treat your cat too well. Your cat's a little finicky. When she finally got the cat to eat it, the cat loved it. And now it's easy. The cat is chewing on it all the time. So we are getting the dogs and cats to love the product. Now, aside from Cell Defender, we talk about pain and inflammation, and it is hard to tell what's wrong with your pet. Unlike humans, we can go to the doctor and we can tell the doctor this hurts, that hurts, this is how I'm feeling. Dogs and cats, you really can't tell. So you look for signs. You look for changes in behavior, expressions of abnormal behavior. If they normally love getting pet, if they start reacting to your touch, if you can tell that their heart's racing, they're breathing heavy, body temperature changes. But the biggest thing is also always going to be if they're off their food and water. If they're not eating their food and water normally, then that's a sure sign that there's something wrong with your pet. And then you look for common areas of pain, of course, along the back, the hips, the forelegs. These are common areas of pain in dogs and cats. We have been treating with our cobra venom peptides. We've actually been treating pets since 2013 and incredibly successfully. For the product that we've had currently, before we made the stronger product for Avini, you could give an older dog or cat that's limping around the house some of the product, and within 24 hours, they're running around like a puppy or a kitten. It's absolutely amazing. We know that there are lots and lots and lots of products to treat pain in humans. You go to the store and go to CVS or Walgreens, look at the shelf. There's lots of choices for pain products for humans. Not so for dogs or cats. For dogs, you really just have kind of Demerol or Tramadol. You have basically narcotics, or you have NSAIDs, non-steroidal anti-inflammatory drugs that cause a lot of issues for dogs, mostly digestive problems. It causes diarrhea, lots of issues with NSAIDs in dogs. Cats can't take anything. Every drug approved for pain in cats causes kidney failure in cats. So in fact, you look at Medicam, it's a single post-surgical injection for cats, single one, because there's such a risk of severe kidney damage and kidney failure. So there's really no choices for cats. So this really and this is the same technology that's in the Plus Relief. It's an extract of cobra venom. It's a 10,000-fold dilution of native cobra venom. And our cobras are milked locally. They're milked in South Florida. We get the venom, we validate the venom, we dilute it ourselves. We validate it ourselves through microscopy and through isoelectric focusing. And we make sure that it's a 10,000-fold dilution, which is incredibly safe. In fact, we've given humans as much as a 30-month dose in a single sitting without side effect. And we've been, like I said, treating dogs and cats with this since end of 2013 into 2014. So we have basically about 10 years experience with dogs and cats. There are now hundreds of publications utilizing cobra venom for the treatment of pain. The very first publications were in dogs in 1847. So this goes back a long way of treating dogs and cats with cobra venom for pain and inflammation. I already talked about other drugs, Tramadol, Demerol, lots of side effects, and really just makes them go to sleep. It doesn't really deal with the pain. But we have Plus Relief for pets. It's pain relief, it's anti-inflammatory, it's all natural, non-addictive, non-opiate, NSAID-free, and it's in the same flavors, the tuna for cats and the chicken char for dogs, and it is available now. So we made it over the weekend. We made it live on Saturday. I've already given some to my dogs. My dogs love it. And like I said, we're getting better and better and better at the organoleptics. So we know that the products work. We know the actives are in the products, but just like with all of our products, we get better every day at color, taste, smell, and mouthfeel. So we make them look better, taste better, smell better over time. And these are getting good. These are getting good, where they're really now loved by our dogs and our cats. Let me get back here. Like I said, I already gave the Plus Relief dogs to my dogs. They loved them. They treat them just like a treat. My dogs are relatively young. They're 3 and 5 years old. But the original focus on this was Nina, who works in my office. She had a 17-year-old Springer Spaniel named Rusty, the Methuselah of Springer Spaniels. And they just loved Rusty to death. He was a great dog. And he had a lot of issues. He was limping around. And we first started using what became the Plus Relief, the regular Avini Plus Relief oral spray. We sprayed his food with it. And he had incredible results. He was running around like a puppy within 24 hours. So we knew that this was the perfect product for dogs. And we made our first product for pets, which has sold very well over the last few years. And now we have our exclusive chewables for Avini. So I'm really excited about this. This is something that every pet owner needs to know about, because pretty much everyone either has a dog or a cat or knows someone with a dog or a cat, especially if they're older dogs and cats in pain. This makes a huge difference. Let's see if we already have any questions, because I always look at the chat. Let's see. Oh, you talked about my book, Invisible Killers? Just so you know, we are working on a reprint of Invisible Killers. I've talked about this before. If anyone's actually read Invisible Killers, it's about toxin in the environment, where they come from, how they get into our bodies through the food, the water, the air. Once they're in our bodies, what do they do to us? How do they cause disease and dysfunction? And then the back half of the book is, what do you do about it? What are modalities for detoxification? And of course, it steers toward the use of zeolites as specific systemic detoxification. The problem is, we had a very short window. We only had 4 months to write the book and edit it and get it out, because we had time schedule for a book tour for me and Dr. Stuart Lonke. And so I'm a little disappointed, because the book is a little esoteric. It reads like a textbook, and it is used in environmental courses in a lot of colleges around the country. But I wanted to make it more narrative. I wanted to make it like we're telling a story. And that's what we're doing now. We're rewriting it now with the goal to have it out by January, with a reversion of the book that should be something that everybody can read. Everyone can read and understand what the dangers are out there, how these things are affecting us. But of course, it's going to tell the story of why everybody really needs to use micronized activated zeolite, which we've now actually branded as detoxilite, which are micronized and activated zeolite. I am excited about the work on the book. Let's see, people like the crunch. Agreed. Okay, no questions yet. That's awesome. Robin, do you have any questions for me?
One just came up, Rik.
Yeah.
Joy just asked a question.
Oh, and starting taking the treat, how soon might a dog with arthritis? For the most part, we see benefit within 24 hours. You give them 1 or 2 treats. Like I said, we've seen especially older dogs and cats that are limping around. Within 24 to 48 hours, they're running around like puppies and kittens. We actually followed, for one of the commercials we did, we followed dogs and cats over a summer, over 3 months. And we have video of a dog that could barely get up, and he's bounding up and down a flight of stairs. There was another dog that was limping around, and he's jumping into the pickup truck, his owner's pickup truck, back and forth, in and out. We had a cat named Charlie that was a pretty fat old cat that was limping around the house, and 3 days on the product, and Charlie was jumping up on the kitchen counter. So it was really, really impressive. So you're going to see results pretty quickly, especially in older dogs and cats. But we've seen benefits in arthritis and hip dysplasia. We've seen a lot of benefits across the board. And just so you know, we were published, we're in a book called Multimodal Treatments for Canine Arthritis. It's a textbook that's taught in veterinary schools. And they mention us, our technologies, and Cobra Venom and our products in that book. So veterinarians right now are learning that one of the ways you treat pain, especially arthritis in dogs, is using Cobra Venom, and we're the ones that make it. So that's nice.
There's some more came up.
Okay, let's see. Neil's keeping me on the straight and narrow.
Absolutely. My
does it make a difference if a dog gets a cat? No, they're the exact same product. Just the flavor is different. This was a Neil decision. I wanted to make one product for dogs and cats, and he goes, no, you have to have a product for dogs and a product for cats, because people don't want to give their cat product to their dogs or their dog product to their cats. So yes, it doesn't matter if a dog gets a cat product, cat gets a dog product. In fact, when I first made the cat products, my dogs grabbed them right on my hand. They ate like 6 of them because I was holding them and showing my wife, and my dogs just grabbed them. Yeah, not a problem. Pain, we certainly, you can use these in horses. People are talking about this in horses. Yes, if a horse wants something that tastes like tuna or chicken, they can certainly use it. But I got to tell you, we make a topical for horses, which is really just the same as the Plus Relief gel, topical gel. So you can use the Plus Relief topical gel and rub it into the joints of horses, and it works wonders in horses. We have someone who's a barrel rider in Utah, and they used to use a liniment with DMSO and a bunch of other stuff. And it was so caustic that the trainer had to wear gloves to put on the horse, and then had to wrap the horse's joints after using it. Started using our stuff, and they don't have to wrap anymore. They don't have to wear gloves, because their stuff, of course, is completely non-toxic. They just rub it on the horse, and the horse does amazingly well. And it's really just what is sold now is Plus Relief topical gel. Larger print for my book. Okay. Should the treats be given for behavior, nutrition at all, or what? Certainly, the Cell Defender treats are for general systemic detoxification. So that's for general health. It's going to make your pets healthier. Same reason you take Cell Defender, you should give Cell Defender to your dogs and cats. But when it comes to pain, like I said, it's easy to tell in an older dog or cat that's in pain. We see they have more bad days than good days, and that becomes an issue. But if there's other things that could be causing pain, of course, you want to go to a veterinarian and find out what's wrong with your dog or cat. But a lot of dogs, especially larger breeds, have hip dysplasia, arthritis, German Shepherds, Rottweilers. A lot of the larger breeds, they're going to have arthritis and hip dysplasia. This is certainly a product that's going to help. It's going to take away that pain without the narcotics that's just knocking them out, and without the NSAIDs that cause all the side effects, digestive side effects. For larger animals such as horses with the same number of treats being needed, yeah, it's funny. It's hard to explain because everyone thinks that dosing is always dependent on weight. And a lot of medications, that's true. It's milligrams per kilogram. But in this case, we're actually blocking a specific receptor in the nerves. I don't want to say blocking, we're modulating the the alpha-7 acetylcholine receptor, which is the same receptor in dogs, cats, horses as it is in us. And it's not about the size of the animal, it's the number of receptors. And believe it or not, no matter how big you are, you have the same number of receptors. In fact, if you look at the nerves of horses, the nerves are just bigger. They have the same number of nerves. They're just actually bigger in a bigger animal. And so the dose is the same regardless of the size of the animal. And that's true of humans too. When I talk about 3 or 4 or 5 sprays for the oral spray, it doesn't matter how big you are. The dose is the same no matter your size because you have the same amount of receptors. Believe it or not, me and Darren have the same amount of receptors. And Darren is clearly twice my size. Is Darren still listening? Yeah, there he is. So it would be the same dose. Let's see. People can use Avini Plus for their pets or animals to give to horses. How much per dose is a good question. So yeah, we just talked about that. They could use the same dose. We were recently, someone said the roll-on was less potent as gel. They're the same product. Yeah, they're the same product. What's in the roll-on bottles and what's in the easy squeeze bottles is exactly the same product. In fact, we make it as one batch. The only difference is the packaging. If you want to roll on, we can roll it on and have a more controlled use of the product. Some people like the roll on too because it's like acupressure. You can feel exactly where pain is and rub it in a little bit. And in fact, people like the roll on so much. At one point, I was going to discontinue the easy squeeze, but we sold our first batch to India in 2016, and they only ordered the easy squeeze. They didn't order any roll on. And I asked them why, and they said, we like to share the product, and the roll-on is unsanitary. So that didn't even occur to me about sharing the roll-on. They got the easy squeeze. So it's exactly the same product. There's no differences, just the packaging.
Hey, Rick, we've talked about it before because I have, and I know you have, why you should use the oral spray for oral spray and why you should use the gel for gel and not try to mix them up if you can help it.
Okay. No, Darren already proved it. You can spray the spray on your skin if you want.
You can, but
yeah, but we do recommend the oral spray is made specifically for oral use. It's made to be attracted into the bulky mucosa in the mouth and be absorbed. And that's really for systemic pain. So you have large areas of pain. If you have like back pain, arthritis, rheumatoid arthritis, you want to use the oral spray. That's going to work all over your body. Now, it does take about 5 days. This is for humans, for it to maximize. It over time, as you use more and more over time, it gets better and better and better. And you're going to see most of the benefits after 5 days with the oral spray. Now, the topical gel will work within 20 minutes, but it's very site specific. The topical gel works best where there's less muscle and fat. So your hands, your wrists, your elbows, your knees, your ankles. It's not that great, especially if you're a heavier person, like over your back and things like that, because the muscle and fat is going to get in the way of absorption to the nerves. Not that you can't use it, you certainly can. It's just not as effective as where there's less muscle and fat. But it does work within 20 minutes. The topical gel lasts about 4 to 6 hours. There is a little alcohol in the gel, and I've talked about this before. Someone said, I used the gel and it burned me. You probably had a cut or a scrape on your skin, and what burned you wasn't the cobra venom. It was actually the little bit of alcohol we use as a carrier that's in the topical gel. So it's isopropyl alcohol, just like any rubbing alcohol we use as part of the product. So yes, if you have an open cut or sore, it's not dangerous, but it's going to burn a little bit. Same thing with people that use it like around their eyes. We recommend not using it right around your eyes because if it gets in your eyes, it's going to irritate your eyes. not because of the product, because of the alcohol that's used as a carrier. But like I said, topical gel works right away. You can use both together. For example, I work with a lot of patients with rheumatoid arthritis. They'll use the oral spray and it's amazing, but they have the arthritis in their fingers, they have nodules. They'll rub the gel in their fingers and on their hands and get immediate relief. So you can certainly use both. The only real side effect, especially when you're using a lot of the product, is a potential for a mild dehydration. So people call me and say, Rik, I took your product, you gave me a headache. No, you were dehydrated and lack of water gave you a headache. So use the product, make sure you're drinking plenty of water. You're not going to have any issues. Okay. Let's see. Is there a limit to how many treats they can have daily? No, there is not. There's no upper limit. They can eat them. In fact, if they get into the whole bottle, the only bad thing is you got to buy another bottle. There's no safety issues here whatsoever. Let's see. Silver and Cell Defender for horses' eyes to fight flies. I don't know. I'm not a horse person. I don't know what fights flies. Certainly, it's not bad for them, but I don't know. That's a good horse question. I'll ask my guy at the University of Kentucky. No dosage and quantity. Someone already answered that. When will there ever be samples for people?
Yeah, Rik, will there ever be samples for people? The answer is we have a new machine in the
Yes.
new place that we're going to start off by doing the powders as we've told you. Once we get the powders working, we will start experimenting with the gels.
Yeah, we were at the new place today, and I don't even know if I told you, they got the frame off the door and the tube fillers in the room.
Good way to go.
Yeah, so they got the tube filler in the room. But I tried to set up the form fill seal machine today. Dr. Carla Gibbs is validating it. So hopefully the next couple of weeks, we will validate that machine and start filling pouches to test. But the first individual pouches are going to be the powdered product, the fiber and the trim science. But it does have a replaceable head. We can put a piston filler in there. And I would love to make little pouches of the gel. So you can hand out samples of the gel. Because for the most part, for the great majority of people, the first time they use the gel, they get relief right away. And I've done meetings, if people feel like surfing YouTube and looking for some old shareholder meetings I did for my public company, we had a product back in 2010 called Cobroxin. And I would throw out samples to the crowd. I said, anyone have pain? I don't want you to disrobe, but anyone have pain like in your hands, your ankles, your elbows, your wrists? And I would pass out the product. Then I'd start talking about myself, my company, about Cobra Venom. And then about a half hour later, I said, by the way, who tried the product at the beginning of the meeting? And people start going like this. They start making fists and waving their arms around. Next thing, they're jumping around like a tent revival meeting. It becomes insane. I can't believe it. Oh my God, my pain is gone. I didn't even realize. I'm like, calm down, calm down, calm down. Of course, I get mobbed at the end of the meeting. Everybody wants samples, how to buy the product. So it is amazing that the gel works so well. It would be nice to have a 2 ml or 3 ml sample where people could try it once and see right away how beneficial it is. And the other thing people don't realize with the gel product, they just assume it's going to be hot or cold or smell bad, but none of those issues with this product. There's no heat, no cold, no smell. It's just these Cobra Venom peptides that go in and block pain and inflammation without any of the stuff that people are used to with topical analgesics. Okay, let's see. That's samples. Yes, we need to train everyone on this. Feet work great. In fact, we
actually works really well for neuropathy on your feet.
Amazingly well for neuropathy, diabetic neuropathy. We actually launched a product years ago that's weaker than the Avini product. We sub-marketed. We called it Luxury Feet. And all it really is the roll-on gel in a bottle that says Luxury Feet on it for women's feet for wearing high heels. That was my wife's idea because she uses it before she puts heels on. So yeah, absolutely great for her feet. How many oral sprays per day to get fast results for pain? Everyone's an individual, so it works differently in everyone, and especially with the type of pain they have, the nerves that are innervated by their pain. But we do recommend using more at first. So even though we say 2 to 3 sprays a few times a day, I certainly recommend when people are starting out, especially people who have a lot of pain, 4 to 5 sprays, 4 to 5 times a day. There's no upper dose, so it can't hurt you to use a bunch of it. What happens over time, though, is your body gets more and more and more sensitive to it. I've actually talked about this before, this concept of induced fit. For the peptide to bind to the receptor, it doesn't bind perfectly. The receptor actually has to undergo a conformational change to accept the peptide. My best example is if you ever have a key that doesn't fit a lock and you got to jiggle it a little bit for the key to go in the lock, and over time it fits better and better and better. It's like the lock starts to get used to the key. That's what's happening here. The conformational change by the receptor occurs more and more readily over time as your body grows more and more sensitive to the peptides. And so over time, you need less and less and less of the product to get the same benefit. So I'm a great example. I have chronic pain. I have a syringomyelia, a syrinx in my back from a car accident many years ago. And there's really nothing I can do about it. The surgery could leave me paralyzed, so I elected not to have the surgery. But I have chronic pain. But now I'm at the point where I use the product once or twice a week and I'm pain-free. I have no issues because my body's now so sensitive to the product, I need very little to get all the benefits. So that's cool because it's actually the exact opposite of every other pain drug in existence. Every other pain product in the market, you grow more resistant to it over time and need higher doses to get the same benefit, where eventually it just stops working for you. That's called the ceiling effect. You have to change products. Not so with ours. You need less and less to get the same benefit, which of course is terrible for sales, but great for people using it. All right, feet, we said how many times per day? Okay, so people are asking about using the gel orally. I got to tell you, it tastes terrible. It's not made to be used orally. It's not bad for you. But two things. First of all, there is a little alcohol in the gel, and especially if you have a sore in your mouth, it can irritate. But it does taste pretty bad. Although I don't know who told me. Maybe it was Darren. Yeah, Darren tried it, and he said that it tasted okay. I think it tastes terrible. So it's really not meant for oral use. It's meant for topical use. The oral spray is meant for oral use. We did studies at Nova Southeastern School of Dentistry, and they used the oral spray pre and post oral surgery, and just pre and just post. So they had 3 arms of the study. And they found that when people used it pre-surgery and post-surgery, they had less bleeding, less inflammation. They healed better. They had better patient outcomes. So it's fabulous. They also used the topical gel for TMJ. They had them just rub it into the TMJ, into the joint. And they had incredible benefits with less clicking, less pain, and people that suffer from TMJ. So that would be topically. I also say this for migraine headaches. If you're in the middle of a migraine, if you're suffering from a migraine, using the topical gel at the temples and at the base of the neck and the back, the migraine goes away really fast. So it's really great at just relaxing everything and getting the migraine to go away. If you are a migraineur, which means you suffer at least 2 to 3 migraines a month, I recommend using the oral spray as a preventative, as a prophylactic. Using the oral spray, just a few sprays a couple times a day and drinking plenty of water, we've seen prevent migraine headaches over time. So there's both treatment and prevention.
Also, Rick, if I could add to that, even though, because that's one of the ones I use a lot. I use it for bone in my knees on a regular basis. So I use the spray and the gel constantly, okay, every day. I don't use it, like he says, I don't use it as much. In the beginning, I was 5-6 times a day. Now I'm 2 or 3. But what I also found interesting is, I don't know if any of you have ever had trigger finger. It is not a fun deal, but I've actually gotten rid of my trigger finger with the product, and that's pretty amazing because usually you have to get it operated on.
Yeah, we've seen amazing results, and we've seen stuff that we just never expected. I told this story a few weeks ago, and people keep telling me to tell the story. But one of our investors, about 5-6 years ago, started using the product because he's in his late 50s and he has back trouble. He calls me crying. I'm like, "What's going on?" He goes, I took this for my back, but I got to tell you, Rick, when I was 9 years old, either 8 or 9 years old, he got hit in the face with a baseball, and it shattered his cheek and his orbital. And it was a long healing process. And he has not felt his cheek since he was 9 years old. And a week on our oral spray, he felt his cheek again. And I'm like, it was like an oh my God moment, because what's happening is exactly what I said. We're not a nerve agonist or antagonist. We're not turning it on or turning it off. We're modulating the signal through the nerve. And apparently he had such a strong signal going over there, the nerve just shut it off. By modulating that signal now, he started to get feeling again in his cheek that he hasn't felt since he was 9 years old. So these are like these happy side effects from a healthier nervous system, from the nerves functioning the way they're supposed to. So it's very cool. Someone says, are they good to take with vitamins, or should you cut down on vitamins? I don't know which products they're talking about, but of course, all of our products can be taken with other supplements. We don't make a multivitamin, although I recommend that everyone eat a healthful diet and take a multivitamin. Neil and I decided from the very beginning, we weren't going to make generic products. We weren't going to make products that you can pretty much buy at Walmart. So all the products you're going to get at Avini are very, very different from anything you can get anywhere else. But certainly, not only can you take vitamins, but when you talk about the zeolite, it's been proven that because the zeolite removes toxins and heavy metals that can be absorbed in competition with nutrients, it actually becomes a nutritional enabler. So when you're using the zeolite, it actually makes your other products work better. You get better absorption of the nutrients from your food and the nutrients from your supplements. So yes, you can certainly take supplements with it. Let's see. Someone said plush relief oral spray for smoker to help stop smoking. Yeah, we can't make, Dr. Chan, we can't make that claim that we prevent smoking. That's actually a health claim that's not approved for the product, but you're not wrong. We do bind to the nicotinic acetylcholine receptor. And at first, we actually told people that this might not be beneficial for smokers. We thought smokers would inhibit that receptor and it might not work as well. We found out that it works incredibly well for smokers. In fact, my wife's hairdresser was a chain smoker and she was getting arthritis. She was actually having trouble cutting hair. I said, I don't know if this is going to work for you, but try this product. And it was amazing. Her arthritis went away. She was of course, my wife is happy because it's our favorite hairdresser. My wife's hair looks great. So yes, it does work in smokers. She did eventually quit smoking. I don't know if we had anything to do with it, but it is interesting that it does bind to that receptor and modulate that receptor. So if in fact a smoker that wants to try this, we could see that if it's something that might help with cessation, but we cannot make that claim. It's not a legal claim for the product. Oral spray and have a toothache gum issue. The gel is great on painful areas. Not that bad. Okay. So someone says, man up, Rick. Yeah, so the taste is the taste. I think it tastes terrible. I'm going to tell you this because I actually have experience with this, because before we made the gel in a squeeze bottle and roll on, we had a gel spray, a topical spray, and an oral spray. And we used to mix them up all the time. And I would spray the topical spray in my mouth and it tasted terrible. That's one of the reasons we went to a topical gel and an oral spray, so we could make sure that we differentiated. If you're making someone dealing with infection start with 1 ounce of nanosilver, should they start with lower dose? No, that's actually pretty good. If someone has an active infection, it can certainly take more of the silver. I know it's just a 4-ounce bottle, but yeah, you can take up to 1 ounce, of course, swish around your mouth and take it in. You can use a higher dose, especially if you're fighting an infection, because that's really what it's for. Whereas the zeolite takes out all the unliving things, the non-living things like toxin and heavy metals. The silver is dealing with all the living things, the bacteria, the parasites, the molds, and things like that. See, Avini Health to sure fit your natural on a batch has quite an amazing story about Avini Health. Oh, so someone has a testimonial on someone who had smoked heavily for decades and is trying to get out of it. All right, I got through all the questions, Neil. Do you have anything else?
I think it's a wrap. Thank you for taking the time, Howard. Why don't you shut off the